Hi, welcome right now to this program. I'm glad and so happy that you are here and you have joined to listen and to this video recording. As you know, this is my channel in which I talk about lifestyle diseases. And some of you have already consumed video 1 and video 2. Video 1 was an introduction, and video 2 we started talking an introduction to the lifestyle diseases. But now I want to home on to specifically on diabetes, the disease called diabetes. Once I'm through diabetes, then I'll go to other lifestyle diseases, and so that people can have information that can be able to help them to manage their lives very well. I have written a book called Dietary Management of Diabetes, and it is from this book that I am recording these videos and the ones which are going to follow. And therefore I encourage you to contact me so that you can get this book, Dietary Management of Diabetes, so that it can help you personally if you are suffering from diabetes, or your friend or your relative. And if you have some people that you know that are suffering from diabetes, please encourage them to watch these videos, and at the same time encourage them to buy my book, which is Dietary Management of Diabetes. And my names are Dr. Alfred Doki Ogao. And as I've introduced myself, I am not a medical doctor, but I am a lecturer of biochemistry, medical biochemistry. And from my knowledge of medical biochemistry, I bring this information to you because lifestyle diseases are basically based on metabolic processes, metabolic pathways that take place in our bodies. So I want to specifically introduce and bring to you the first phase of diabetes. So what is diabetes? And as you know, I illustrate to you a simple definition of diabetes is that it's a condition, is a chronic condition in which we have elevated glucose concentration in the blood, and we call it hyperglycemia. So when you have hyperglycemia, it means you have very high concentration of glucose in the blood, and that can cause problems when it is constantly very high, because the normal glucose concentration in the blood should be between 3.9 and 7.5. Within there, that range is safe, but anything above 7.5 becomes dangerous. And if that consistently continues being that, it can create a lot of problems for your eyes, for your legs, for the kidneys, for the liver, and everything else in the body. So you need to come to a point where you can be able to control the diabetes. So if you have a friend, as I've said, friends, relatives, or your mom or your father or your grandmother who suffered from diabetes, it is time that you need to be able to learn how to control this chronic disease. So I want to start by specifically talking about causes of diabetes. What causes diabetes? What brings about diabetes? And of course, as I mentioned in the lifestyle diseases introduction, normally it comes from the food. But let me give you cause 1, 2, 3, 4, 5 so that you are aware that you are dealing with something you know. We need to have, when you are suffering from diabetes, you need to know the causes. What are the main causes of this disease? So diabetes is a complex medical condition characterized by elevated blood sugar levels. And there are two main types of diabetes, type 1 and type 2. And here are the primary causes of these diseases. These are chronic conditions that we have. So type 1 diabetes. What causes type 1 diabetes? Type 1 diabetes is caused, number one, by autoimmune response. In type 1 diabetes, the immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. The exact trigger for the autoimmune response is not fully understood, but it is likely a combination of genetic and environmental factors. That's number one, autoimmune response. And number two cause of type 1 diabetes is genetic predisposition. This means that individuals with a family history of type 1 diabetes have a higher risk of developing the condition. Certain genes are associated with an increased susceptibility to autoimmune disorders. That's number two, genetic predisposition, where like if you have a history of maybe grandfather, grandmother, mother, father, maybe your siblings, brothers and sisters, then that's what we call the genetic. It actually moves in the family. And number three cause of type 1 is viral infections. Viral infections. Some viral infections, such as certain enteroviruses, may play a role in triggering the autoimmune response that leads to type 1 diabetes. And so these are the major three causes of diabetes type 1. What about the causes for diabetes type 2? Type 2 diabetes. What are the causes? The causes are, number one, insulin resistance. The primary cause of type 2 diabetes is insulin resistance, where the body cells do not respond effectively to insulin. This leads to an increased demand for insulin production to maintain normal blood sugar levels. I always equate this insulin response to something like this. Like, for example, you have a store and you are keeping boxes in that store, boxes of various things. And then the store gets full. So when the store gets full, when you try to store more boxes, they come out. They can't go in. They come out. They come out like that. What happened to this is that when we eat food, carbohydrates and many other maybe fatty food and which bad fats that we are eating, these fats go and congest the liver cells and also the adipose tissues, where when glucose is in the blood, insulin facilitates it to be converted into glycogen and stored up in the liver and in the body cells like adipose tissues. And therefore, once the liver is full of this fat, and also the cells of the body and especially adipose tissues are also full of the fats, then when now more glucose comes in to be stored up, the insulin cannot be able to store the glucose because the store is full. The liver is full of fats. And so one way of being able to store in there is to remove the fats. And that's why I encourage diabetic people to do exercises. Because when you do exercises, you burn the fats that are in the liver and the fats that are in the adipose tissues. And therefore the liver becomes empty and you can be able to store now the glucose and in glycogen into the cells. But without that, it can't work out. I'll explain this later on when we have more talk on that one. So number one is insulin resistance. Number two is genetic factors. Genetic factors also play a role in the causes of diabetes type 2. Genetic factors play a role in the development of type 2 diabetes. Individuals with a family history of the condition may be more predisposed to insulin resistance. And number 3, the mother of all, lifestyle factors. Unhealthy lifestyle choices such as poor diet, lack of physical activity, and obesity significantly contribute to the development of type 2 diabetes. A diet high in refined sugars and saturated fats combined with sedentary habits can contribute immensely to insulin resistance. So the type of foods that we eat can cause diabetes to us, because when we are used to eating sugary foods, we eat refined carbohydrates, and we end up with a sedentary type of life. We don't do a lot of work. We sit around and we just eat and sleep. This is dangerous. So we need to walk and do exercises so that we can be able to keep away. So our lifestyle, and maybe we eat this, what we call the red meat, a lot of it, nyama choma every now and then, and all those kind of things, and we smoke and we drink. These are all factors that can contribute to onset of type 2 diabetes. So we go to cause number 4 of diabetes type 2. And cause number 4 diabetes type 2 is the risk of type 2 diabetes increases with age, particularly after the age of 45. Certain ethnic groups also, including African Americans, Hispanic Latino Americans, Native Americans, Asian Americans, and Pacific Islanders are more prone to developing type 2 diabetes than other ethnic groups. And then cause number 5 is what we call gestation diabetes, and we also call this one type 3 diabetes. So women who experienced gestation diabetes during pregnancy have an increased risk of developing type 2 diabetes later in life. So type 3 diabetes is some women, when they are pregnant, they develop type 3 diabetes. And after they have developed that one, but the moment they give birth, the diabetes 3 disappears. And that's very good. But these women now, in the future, they may be prone to developing type 2 diabetes. And cause number 6 is metabolic syndrome. Conditions associated with the metabolic syndrome, such as high blood pressure, abnormal cholesterol levels, and excess abdominal fat, contribute to insulin resistance and increase the risk of type 2 diabetes. So that means we eat food full of a lot of cholesterol in the food, and mostly is saturated fats, and that can lead to danger development in diabetes 2. And then number 7 is what we call polycystic ovary syndrome, which normally appears in women, PCOS. So women with PCOS, which is abdominal hormonal disorder, are at risk of developing insulin resistance and subsequently type 2 diabetes. So understanding the causes and risks and risk factors for diabetes is crucial for prevention, and also early detection and effective management. So lifestyle modifications such as maintaining a healthy diet engaging in regular physical activity, and managing stress. These play a key role in diabetes prevention and management. So regular medical checkups and screenings are also essential for individual to prevent risk factors or symptoms associated with diabetes. Recognizing the symptoms of diabetes is also very important, and we had mentioned this in the introduction, but let me just mention here that diabetes often manifests itself subtly with the symptoms that may be easily dismissed. And that is symptom number 1 is increased thirst, and then you have frequent urination, and you also have unexplained weight loss, and you have fatigue. You just feel tired. Even when you come from sleeping, you just feel tired. Even when you have not worked or walked, you just feel tired. These are whispers of the body signaling a potential disruption in glucose regulation. The body is talking to you and is telling you something is not right somewhere. When you have a lot of thirst, every now and then you drink a lot of water, and then you urinate a lot, and you lose weight, and you become fatigued. Those are symptoms that are telling you that something's not right in the body. You need to check up. You need to go for medical checkup when you feel that way. So central to the understanding of diabetes is the role of insulin. And insulin is a hormone that acts as the gatekeeper of glucose entry into the cells. So this is very important to understand. And also the other thing which you need to do is navigating the long-term complications. So beyond the immediate concerns lie the long-term complications of an uncontrolled diabetes. From cardiovascular issues to kidney diseases, nerve damage, and vision problems. This section is going to explain how this come along when there is very poor management of diabetes. So diabetes must be diagnosed early, and then management should be set into motion very quickly and early in life. When we neglect diabetes management, it can lead to a range of serious and potentially life-threatening consequences. So proper management is essential to control blood sugar levels and prevent complications associated with diabetes. And I'm just going to mention some of potential consequences of neglecting diabetes management. So as I've said, once you realize those symptoms are there, please go for medical checkup, be diagnosed, and start early management. And when you do early management and you're controlling it, there will be no problem. So what are some of the long-term life-threatening complications that can result when we neglect to manage diabetes? And that's why I'm telling you, please buy my book, Dietary Management of Diabetes. Contact me. I'm going to give you my contacts at the end of this video, and call me, and you should have this book as your guide. Be with it and to control you, to tell you what to eat, what not to eat, what to do, what to do not to do, and all those kind of things. So complication number 1 is hyperglycemia, high blood sugar, when the diabetes is not controlled. Prolonged neglect of diabetes management can result in consistently high blood sugar levels, which is known as hyperglycemia. And hyperglycemia can lead to symptoms such as increased thirst, frequent urination, fatigue, and also blurred vision. The opposite of this is what we call hypoglycemia. That is low blood sugar. And that is somebody you have diabetes, but you don't eat regularly, or you eat very poorly. Sometimes you go fasting. If you maybe you're a Christian, you go fasting or things like that, and you develop in the body, you end up with low blood sugar. So this is like inconsistent medication or insulin use combined with irregular eating habits can lead to episodes of hypoglycemia, which is low blood sugar. And the symptoms of hypoglycemia include shakiness. You just shaking, your body shaking, and you become confused every now and then. You become irritable. Every now and then, when somebody just says something very small, you get irritated, you get angry very quickly, and you sweat. And then, in the severe cases, you lose consciousness. So, in both cases, the opposite. Hyperglycemia should be controlled. Hypoglycemia should be controlled. The normal blood sugar should be between 3.9 and 7.5 milligram per dl. And that's okay. So when you control within that range, you are okay, no problem. You lead a normal life. And another one is number 3 is cardiovascular complications. Neglecting diabetes management increases the risk of cardiovascular complications, which includes heart disease, stroke, and high blood pressure. So diabetes accelerates the development of atherosclerosis, which is hardening of the arteries, leading to increased cardiovascular risks. Another complication could be neuropathy, and a long-term uncontrolled diabetes can cause nerve damage, resulting in neuropathy. So neuropathy can lead to symptoms such as numbness, tingling, pain, weakness, and often starting in the extremities. So that's one problem. Number 4, when you don't control diabetes. Another problem when diabetes is not controlled is nephropathy. And nephropathy is kidney damage, because diabetes is a leading cause of kidney damage. Neglecting blood sugar control can lead to nephropathy, which can lead to symptoms such as nephropathy affecting the kidneys' ability to filter waste from the blood. And advanced kidney diseases may necessitate actually dialysis or kidney transplantation. So this is dangerous. So high blood sugar levels in the blood is dangerous. And the other one, number 6, is retinopathy. That is eye damage. High blood sugar in the blood can lead to eye damage, which is called retinopathy. So diabetes retinopathy is a major cause of blindness among adults. So regular eye checks are crucial for early detection and intervention. Number 7 is food complications. Poorly managed diabetes increases the risk of foot amputations, including infections, ulcers, and poor wound healing, especially in type 1 and even type 2. When it is not controlled, the legs will be amputated and it is dangerous. So number 8 is compromised immune function, and number 9 is mental health issues, and number 10 is reduced quality of life. So this is when diabetes is not controlled. But when you control diabetes, you will lead a normal life. And diabetes should not cause death. No, you lead a normal life, you go to work, you do everything. I know people who are diabetic, but they are leading their normal life, quality life, and everything is fine with them. So you just need to recognize the causes and then recognize also how to control it. That's why early detection is important, and then you can control, and I can assure you, you will lead a normal life. Buy my book, Dietary Control, Management of Diabetes, and it will give you details of all this, and you'll be okay, safe. So invite people, your brothers, your sisters, and everybody to watch this. And please subscribe, like, and share with your friends. God bless you.